Hello, everybody, people who speak English in our school, in our television. Today, we carry on doing information in our NPR TV. T.M.J is a topic that everybody talk all around the world. We will talk about T.M.J today regarding the therapy, why we failure in our therapies. In our short topics, in our short term, in our short video, I will explain to you what is the point of view of the NPR International School. That is the things we teach at our students all around the world, in America, in Europe, and in Asia. Don't miss this transmission. T.M.J today. It's very important to understand the causes of the dysfunction of the craniofacial system. It's not T.M.J's, because the T.M.J's, as I told you before, is part of the craniofacial system, and it's very important to understand that. Today we will talk about what can cause a dysfunction and the division of the pathologies in the T.M.J's. And I will present the PowerPoint of the things of today. T.M.J's. T.M.J's is a very, very important topic. Everybody talk about T.M.J's. It's famous. This joint is very, very famous. The most important joint in our body, because everybody talk about that. But we will try to clarify different things about it in different videos, as you see in our television. Let's talk about treatment and why it fails. What is the error? Because we have an error. Sometimes we fail in the treatment and we don't know why. To understand this, we have to divide the pathology of the T.M.J into big divisions: dysmorphisms and dysfunction. Look at that. We say that ever in our school. Medicine is divided in dysmorphisms and dysfunction. As you pay attention about that, you will understand that that is true. I will give you some samples. For a dentist, where you will put the decay under this classification? Very simple. The decay is a dysmorphisms of the anatomy of the tooth. And who produces a dysfunction? We don't eat well, we eat more sugar than the normal, and we don't clean the teeth. That dysfunction is creating a disease that is a dysmorphism. A dysmorphism is an alteration of the form. We would say that the same is in the T.M.J's. And then we go through what is a dysmorphism. It's the alteration of the shape within our body. When the anatomy change the shape, it is a dysmorphism. The causes are a lot of causes, and the same is in the T.M.J's. And that is very difficult to correct. Normally, is intervened with surgical procedures, and we know the only alternative is to improve the situation. We will never go again, very difficult to go again how the form was, the shape was. And as you see in these X-rays, then we have alteration in the condyle, and this is dysmorphism. Maybe the beginning dysfunction, increasing depression, chronically was creating a dysmorphism. But for example, arthrosis is a dysmorphism. A tumor is a dysmorphism. Fortunately, only 5% of the pathologies of the T.M.Js are dysmorphisms. And then we go to the dysfunction. 95% of the pathology of the T.M.Js are dysfunctions. And normally they are related or linked to changes in the position of the condyles. You know, because we're talking about that before. The T.M.Js is a very different joint that it doesn't accept the increasing of pressure inside, because it can be deformed and it will transform into dysmorphisms. When the jaw is changing the position, you know that because we got a video of that, because when this changes the position, the alarm of the brain, the central nervous system, is starting the blood systems to protect, and that generates great local and general dysfunction. And as you see, we have two different things in main groups in the T.M.Js. It's dysmorphisms and dysfunction. And if we go through this classification, you will see very easy to treat it. Very, very easy. If you understand if the pathology is dysmorphisms or a dysfunction. It's very, very easy to treat. And when that happens, we have a lot of symptoms. We have a local pain, obviously. There is a local pain, muscle pain, joint pain, etc. We have a general pain. Why? Because this local pathology is creating a postural alteration. And if we leave it, we have a lot of chronic pain. Imagine. If we understand that, we can intervene early in the treatment. We always will say in the growth age is the time to prevent. And if you follow that things I am teaching you, you will understand that the age of prevention is early age. But imagine, local pain, general pain, postural alteration, chronic pain. That is the thing we will have in our body. And then we go to the therapy. In our protocol, the therapy for T.M.Js also is deprogramming first and reprogramming. You know, NPR is this. Deprogramming to allow a good physical rehabilitation and then reprogram. We see what we do regarding T.M.Js, and all is related with the changes in the position, normally 95%. And you will see also that we have to do an interdisciplinary therapy, just not one specialty therapy, and that's very important we understand. The objective of the therapy is make a decompression into the joint, to have a condyle and meniscal synchronization, to have a good mandibular centering, and then do a progressive reprogrammation of the jaw to obtain the vertical neuromuscular postural dimension, where we will create a functional occlusion. That's it, the therapy objective. We do that with an interdisciplinary protocol, as is NPR, we will resolve the problem permanently. But we have to follow this step, not only do one of them. For deprogramming, we use the BED device, body equilibrium device. That is a thermoplastic device that we use normally at night time, whose objective is to cancel the negative effect of the craniofacial system dysfunction. You know, the craniofacial system, when it's in dysfunction, is creating a lot of problem in the body. And then, with this device, we can deprogram the jaw, allowing its centered relationship. With this device, we can obtain the central relationship of the jaw, and that's things we normally dentists are found in. And then, with the programming the craniofacial system, we do a physical rehabilitation normally with osteopath and physiotherapist, and the osteopath and physiotherapy also do local therapy in that moment when the jaw is deprogrammed. And then the next step is to do the functional reprogrammer. That is a device, normally lower device, that is used at night most of the time, which performs progressive mandibular reprogramming to obtain the postural neuromuscular vertical dimension. That is the most important thing we have to obtain. That is the position of the jaw in harmony with all muscle change of this device, plus the physical rehabilitation help us to do it. And that's why it's very important to, if we want to have a good rehabilitation, local rehabilitation, to do it. This particular device, together with the bed, are working together to obtain the central relationship and the exact jaw position in balance with our body. That means in balance with the tonic postural system. That's the thing we are following. We are finding the good balance between craniofacial system and the rest of the body. If we do that, we will never do relapses in the T.M.J diseases, mainly said in the craniofacial system disorders. And the last step, when we found the central relationship of the jaw, the body balance, is create at last the functional postural occlusion with orthodontics, prosthetic, or orthodontics and prosthetic. This is the reprogramming of the occlusion. As you see, in our school, we said always deprogramming and reprogramming. The last one in the craniofacial system, when we have the local and general balance, is to create a good occlusion. And we have to use all the weapons we have to do that. That is, we call real rehabilitation, local and general rehabilitation. The other things are only restoration. And if you do restoration, normally, residues relapse. Mainly when you do not protect the system. It is the way to cure definitively the T.M.J's dysfunction, mainly known as craniofacial disorders. And okay, we arrived to the end of the presentation. I hope you enjoy it. And if you see, this is all the steps we need to follow to have a good rehabilitation. We call that a good physical rehabilitation. In NPR, it's possible to do that with an interdisciplinary team who work together with the same concept and the same protocol. That is the goal. Okay, we arrived to the end of the presentation. I hope you enjoyed that. I hope you enjoyed it, and I hope I see a lot of you in the next transmission, our channel, in English language. And have a nice day, have a good job, and a good stay in your home if you are at home. And we see you in the next presentation in our NPR television. Remember, NPR television is your television. And I see you next. Thank you so much to be here with us.